Hello and welcome to our Friday webinar. We are on with Dr. Lamb, and she's going to give us the lowdown on the recent ExoticsCon conference, which was, how long ago was that, Dr. Lamb? When was it?
Just about 3 weeks ago.
3 weeks ago. Okay, that's an insider's look at all the rumblings that's going on, the good stuff, the good rumblings going on in the exotics medicine world, learning about the latest and greatest in avian medicine. So let's see. Welcome everybody for just joining us. I'm going to play, just to kind of kickstart a little fun Friday, my Instagram is full of little cute animal videos. And so when one pops up, I kind of save them sometimes because I just find them immensely cheerful. And this is one that I just recently came across. I'm not sure if anyone else has seen this, but I think it also points to the fact that little birds can be trained to do amazing things. So here we go. While waiting for people to log on, I hope people can see this, but the inside of a birdhouse. It's cleaning up. Turn on the TV. Of course, cats and it's clean. Friday rethink the diet.
Hello. Hello. Hello.
Anyways, I thought that was cute. A little human saying hello instead of the bird.
I know, I love that little human clock.
All right, that was my fun share. And you know, that's amazing. I think that bird deserves an Oscar for that performance. That's just amazing.
I think so too. That's a smart little canary there.
And I would love those digs that canary has. I mean, it's a really nice birdhouse. Did you see any besides the diet in the fridge? Maybe you should have stocked it full of NutriBerries or something.
Right.
All right. So if you're just joining us, you're at the right webinar. We're going to go over ExoticsCon with Dr. Stephanie Lamb. Here's let's see. I guess are we doing a screen share? Because I probably need to make you a host for that. Let me do that real quick. And while I do that, if you could just remind us, do you know what anniversary it was for ExoticsCon this year?
I actually don't know what anniversary it was. I think they started maybe 2017, or I think 2018.
Maybe we'll someone Google behind the scenes and we'll put it in chat. We'll have a definitive.
Yes. I know there was with COVID happening, there was the year that it had to go online. And then there was one year also where there was the three groups didn't come together for it. So like it hasn't been a continuous stream every year. But I want to say it was like 2017 or somewhere around 2017 that it's.
Okay. That's yeah. I'll have to check that. Oh, and by the way, I'm sorry. I just before you get started, we gotta remind everybody that you are the now active president of AAV.
Yep, at ExoticsCon, I got inducted to be the active president of the Association of Avian Vets. So it's pretty neat.
I hope that's part of your presentation. Okay, all right. So big congratulations, and I'm going to hand it over to you. And I can't wait to see what's going on in the world of avian medicine.
All right, let me go ahead and share my screen. Let's get this PowerPoint going. All right, so we're going to be talking about what's new in avian medicine. So I know I talked about ExoticsCon. I think it was last year. If it wasn't last year, it was the year before that I did a talk for everybody on ExoticsCon and what happens there. And so just to give you a brief introduction, what ExoticsCon is it's a conference on exotic pet medicine. And it's a little more than exotic pet medicine even, because really it's also encompasses some like wildlife medicine as well, a little bit of zoo medicine too. It's really meant for people who are, or veterinarians who practice avian medicine, reptile and amphibian, and then small mammal. And when we say small mammal, we mean small exotic mammals. So that's kind of anything that's not a dog or a cat. So like rabbits and ferrets and guinea pigs and chinchillas and hedgehogs and all that sort of stuff. Collectively, all those animals are considered exotics. And so in veterinary school, when vets go to veterinary school, there's a major focus on the more traditional species that most veterinarians see, which is dogs and cats, horses, cattle, that sort of stuff. And there's a little less focus on the exotics. So, a veterinarian who wants to see these animals needs to go somewhere to get additional education to really learn about them in order to do a good job of caring for these animals appropriately. And ExoticsCon provides that for people. But also, veterinarians are required, depending upon the state where they live, or the country where they live, they have to keep up on continuing education credits because, the world of medicine is constantly changing, right? And it'd be really great if we could get out of veterinary school and just know everything about all animals and it never changed. It would just make things so simple, but that's not reality. And so we have to constantly keep up on our knowledge base and constantly be learning new things because there's so many things that we don't know the answers to, or things that maybe we get an answer, but then it creates another question or 2 or 3 more questions. And so we're constantly evolving with the information that we have. And so veterinarians have to maintain continuing education credits every year to stay as a licensed veterinarian. And it's different depending upon which state you're in or, what country you're in is how many credits you need. But this ExoticsCon allows for people to get continuing education credits to maintain their license as a veterinarian. So I'm going to focus on just the birds because here we are with Lafeber and we're talking about avian medicine. So there's more going on there than just avian medicine, but we're going to focus on just the avian side of things today. So, what is there that's new out there? Well, there was lots and lots of different talks, and I could not include everything in here because it would just be way too much information. And I wanted to go over some things that I thought might be helpful for people at home to have a little bit of an idea about what is it that my veterinarian, is newly learning about themselves, and how could it potentially help my pet, and what might my veterinarian be talking with me about that I haven't heard about before? Because again, things are always evolving. We're always learning more stuff. So I put a couple categories here. I have some new topics that I wanted to go over, but then also review, because that's the other thing that's really important that happens at these conferences is we don't just learn new things. We have to review things or things that are common because it's really important to make sure that even though it may be something we've already learned about, to make sure that we've got it right. And even in reviewing stuff, a lot of times there'll be a little bit of new information kind of put in there. So these are all the things that I wanted to go over with you guys today to let you know about. And then, of course, I'll leave room for questions at the end, should anybody have any questions. So. All right, so we're going to start off with a new appetite stimulant. And this appetite stimulant, the name of it is called capromorelin, and you see the name up at the top there. That's the drug name, but the brand name is called Entice. And this is something that's actually been on the market for a few years now for mammals. It's really marketed for dogs and cats, and it's meant to stimulate the appetite so that if you have an animal who's anorexic, who isn't eating because of some disease process that's going on, and that animal's losing weight, or we don't want them to lose weight, and we need to support them in some way so that we can try to get them to have an appetite so that they want to eat things and keep their weight up or put weight on, what have you, this medication was created to help with that. And there's other ones that are on the market, but this is kind of a newer drug. And it's been available for dogs and cats. And this is usually how it happens, is that a new drug comes on the market for dogs and cats. And then us avian exotic people go, well, can I use that in a budgie? Can I use that in a rabbit, or what have you? And so we're often wondering, well, what's the dose? Because we have these doses that have been studied in a dog or a cat when this drug gets to the market, and the people who are selling the drug say, this is the dose that you need to use for it to be effective for this length of time. but they don't tell us anything about what the dose is for a budgie or whatever other species of bird it is that we're seeing. So then we have to do studies on our own to really tell, well, what is the dose? What would work for this bird? And so there were actually two talks on this particular drug, and the two species it was studied in that were on birds, because there was actually more talks about it in other species as well, but in birds specifically, there were studies that were done on budgies and then pigeons. And they found they gave the medication to birds, and they also had a control group where there was birds that were not getting the medication, and then they watched their food intake. So they, saw, well, how much are the birds actually taking in? So they compared a bird that was getting the medication to a bird that was not getting the medication at the same time, and just watched how much are they eating, what is their weight, what's going on throughout the day, how much food wastage is left over, that sort of stuff. And they found both in budgies and in pigeons that this medication will work as an appetite stimulant. It does increase the food intake for birds. It's given at a once daily dosage, and the studies weren't a long period of time. It was just over about approximately a week period of time. But it was shown that this can be safely given to birds. It does actively work to increase their appetite. And so it could be an effective treatment that we can give to birds if they're not eating well. And I put budgies up here because they were the ones who was studied in, but I also put a picture of this one budgie here that you can see how he's got a little bit of like spiky feathers. What that is this is a little budgie who was throwing up. And when budgies throw up, they like shake their head back and forth really violently, and they kind of like spray food all over the place. And they'll get their vomit on their head like this. And so this little guy was not eating because he was having some GI problem. So this is an individual who may have done well with getting some appetite stimulant just to get him to take more food in, while we were also having to deal with the primary problem, And that's something that's important, is that yes, a bird may need an appetite stimulant, but we need to think of it as just supportive care. We need to always figure out why a bird is having a problem so that we can treat the underlying problem. That is absolutely key, that we treat underlying problems. But this is a new tool in our toolbox to help us, that we can give them, that if they are not eating well, they could potentially benefit from this additional supportive care. So it's really exciting, I think, because I definitely have had lots of patients who have been anorexic or just not eating with the real excitement that I'd like them to have. And so I'm really excited to now have this new treatment that I can give to birds to help them. So that is the first thing that we learned about that's new and exciting. Okay, the next thing I wanted to go over are these couple of drugs that are actually meant to help lower fat levels in the body. Atorvastatin and rosuvastatin. They're both lipid lowering drugs, and actually some people may recognize these names as drugs that they themselves may take, because lots of people do have high lipid values, for one reason or another. And a lot of people take lipid lowering medications. And I put a picture of Arroyo up here because he's in Amazon. And there's several species that we can see that have a higher propensity to have lipid disorders and lipid-spleening fat. I apologize that I didn't say that earlier. But Amazon parrots, African greys, Quaker parrots, cockatiels, those are some of the more common species that may have high fat levels, but in reality, many species of birds can have high fat levels. Those are just some of the poster children, I would say, that are more known to get disorders where fat levels are really high in the blood. And so many people have questioned, can we use a fat lowering drug like what's used in people in our birds to see if we could lower fat levels. And so it's interesting because here's an example of medications that are being studied that are actually from the human side, not from the veterinary side. You know, the entice stuff came from the veterinary side, right? These are medications that actually came from the human side of things, where, you know, we saw that, okay, people have these disorders, and hey, we're seeing similar disorders in our birds. Can we use medications that they use in humans in our birds to have beneficial effects? Now, again, it always goes back to, well, what is the dose? How much do we give them? Yes, this drug is available and it's on the market, but is it something that's actually going to do anything for the bird? And in the study that was done, that was presented at the doses that they had chosen, which actually are quite a bit higher than what's in people, it didn't really work. So this is one where we go, well, darn, you know, we would like to have this drug available to us for use, but at this doses that it was recently studied at, it didn't really make any effect on lowering their fat levels. That being said, the one of the conclusions was that maybe we just haven't found the right dose yet, and that's something we always have to consider, no matter what the drug is that we're studying. If it doesn't work, is it that it truly doesn't work, or is it that we just haven't got the right dose? And do we need to try something different? And you know, birds are interesting because they really do have a much higher metabolism than us mammals do, and so a lot of times the doses that are used in birds are higher on a milligram per kilogram of body weight level than what is used in a mammal. Sometimes even tenfold higher. So there's certain medications that are out there that, okay, a mammal gets it at this dose, but a bird gets it 10 times that amount, or what have you. So, you know, yes, this study showed that, okay, well, the doses that they used it at, it didn't really do anything. So that's good information. Sometimes people think that when we get these results of this, you know, this wasn't found to be helpful, that it's bad, you know, information. It's not. It's great information. We need that information because we need to know, all right, if this dose doesn't work, well, then we shouldn't use that dose. Maybe we need to use a different dose. And so I'm sure there's going to be even more further studies on this particular medication to help us find a better dose that actually works. Because, you know, again, there's a lot of birds out there with high fat levels, and absolutely there's many things that we need to do, like adjusting their diets or dealing with hormones to help reduce lipid levels. But if we could have another tool in our toolbox to reduce those fat levels and maybe reduce some of the problems that can happen because of high fats, that would be awesome. So future research. All right. Another presentation that was really cool was a presentation on fluoroscopy. And fluoroscopy is really neat because it's kind of like watching a moving X-ray, or radiograph is the term that most veterinarians say. It's a more technical term. And this particular talk really focused on the use of fluoroscopy for gastrointestinal disorders. And I put some pictures up here because these are pictures of a bird with radiographs of a foreign object being in the gastrointestinal tract. And the more typical way of kind of assessing that GI tract is with regular flat or plain X-rays, where we're just getting a picture from a moment in time. But a moment in time is purely that, it's a moment in time. Things can change with time, right? And things change with the GI tract because stuff is moving throughout it. And so what these X-rays are of this bird that had a foreign body, I had to take multiple X-rays throughout the day, where we saw this initial X-ray where we're like, oh, there's a weird bulge over here that isn't quite right. So we had to then give it a contrast agent, barium. This is something that the bird swallows, and it moves through the GI tract. And we take multiple X-rays throughout the day to watch it sort of move throughout that GI tract and see how it moves to help us determine if there's something in there that's not supposed to be, and also what is the motility like. But with fluoroscopy, it's basically, you have the bird sitting in the fluoroscopy unit, and you can have them sit there for a short period of time. You're not having them sit there for hours. That's too much radiation. But for a short period of time, and get like little movie snippets almost, and they're just sitting there on a perch, and you watch that same contrast agent, that same barium that can be administered. You watch it kind of just as it's moving throughout the GI tract, and it's really cool because you could see like the motility of the GI tract and stuff kind of like sloshing around in the stomach or in the crop throughout the intestines. So it's really helpful because, okay, now we're taking this sort of flat film and turning it into this dynamic thing. So now I can really tell what's actually going on in there, and I no longer just have a single moment in time, or like maybe 5 moments in time. Now I've got a few minutes of different moments in time. So it was a really cool talk, and fluoroscopy is something that hasn't been available to all veterinarians really. It is something that is a technology that it is more expensive, but some of the CT scanners that are becoming more and more prominent and prevalent in veterinary hospitals have the ability to do fluoroscopy. So I'm pretty excited after watching this talk that I think I would like to maybe do a little bit more fluoroscopy myself, and see how it can really be helpful for me in understanding better what's going on with certain GI disorders in birds, and helping me maybe get to a diagnosis a little bit quicker in some cases than when I'm dealing with flat films. So this is something that's really pretty cool, and I'm looking forward to using it more. Okay, next thing is something called next generation genomic sequencing. So it's a new way to assess all the different types of microorganisms that are present in a sample. So normally, let's say we have a bird that comes in that's throwing up, and I am worried that there might be like a crop infection, and I take a swab of the crop and I look at it underneath a microscope. I do a gram stain in-house to assess the different floral organisms that are present in the sample, and I look at that gram stain and I see a variety of different bacteria, and I go, okay, I'm worried about an infection, and maybe I want to culture that bacterial organism because I want to see what is actually there. Like, what is this? E. coli? Is this salmonella? What is it that we actually have? Hold on, Arroyo in his normal disruptive mode is getting a pen. Let me get that for him. Come on, step up. He knows we're on a webinar, so he wants to show off.
That's funny.
Thank you. That's right. Go there. All right. He's occupied for the moment. Better to have an Ava cake than a pen, a Sharpie. Constantly have to watch him. Anyways, so back to what this is. Normally we like to take cultures to identify what bacteria are present in a sample. And then we can say, aha, this is an E. coli infection, or this is a salmonella infection, or whatever infection it happens to be. This particular new technology is actually it's not culturing the organisms. It is doing like DNA testing, genomic sequencing, to tell us all the different bacteria that are present. Because something that's interesting about doing a culture is that bacteria in a sample, like if you have like 5 different bacteria on a sample, some are going to outcompete with others, to where when you actually do a culture, well, maybe you only end up getting like 1 or 2 when actually there are 5 different organisms there, because those more, robust organisms sort of beat out the other guys. This allows us to actually see all the different organisms that are there. Now, there's going to be healthy organisms that are identified on this, in addition to organisms that maybe are a little bit more likely to be pathologic or problematic. But it's interesting because this is something that could really change the way we treat infections, because we're probably initially going to be finding a lot of different bacterial organisms to start with. There may be some questions. This is actually probably going to bring up a lot more questions when this is first being utilized, that we're going to go, well, man, we need to do more studies and investigate this a little bit deeper. But this is something that's really cool and I think cutting edge, and something that will probably is going to develop more, potentially be utilized more, may eventually, make us go away with doing cultures. I don't know. We'll see how things change with this, but it really could potentially change the way we treat infections. So the next thing was copper toxicity. So, I know we've talked about it before in different webinars, and I'm sure lots of people have been made aware of it who own parrots, that birds can sometimes get into things that they are not supposed to. Sometimes, just like a royal over there trying to get that pen. Maybe he knew I was going to be talking about toxicity stuff. He was doing a demo for us. Birds sometimes get into stuff that they are not supposed to get into. And sometimes there are items that have heavy metals in them that you really don't even recognize they're in. And we classically we'll hear about lead toxicity or zinc toxicity. Those are the ones that have been reported much more. Those are the ones we understand a little bit better. Now, there's another one for us to be aware of, and it's copper. And we know that copper is out there in various household items, but it also may be one that we need to be paying a little bit more attention to, as it can lead to toxicities as well. And this presenter discussed how various citizen birds, so various parrots, have been found to have copper toxicity, and then they were treated for it and they got better. Because one of the things that's questionable about copper toxicity is, okay, let's say we have a sick bird that's coming in and is showing some signs that may make me suspect there could be copper toxicity. I then have to collect a blood sample and send that blood sample to a lab and run copper levels. Now, when we're talking about lead or we're talking about zinc, there are known levels that are like okay and not going to be causing problems, and then levels that are known to be toxic. We haven't really figured out the exact reference ranges for copper in birds, and there's some complicating factors to it, and it's partially because it may actually be easier to tell toxicity based on tissue samples as opposed to blood samples. But for the most part, we're not going to be taking tissue samples because that's a little bit more invasive. And so we don't really quite know the exact blood levels of what is toxic and what is not toxic. And even if we did, there's still the question of, well, is blood really the best way to tell if we truly have toxicity, and is it reliable to say that there's toxicity? So there's still a lot of questions that need to be answered about copper toxicity in particular. However, this talk really did show that, okay, there were several different birds that were showing particular signs. They had reason to suspect possible copper toxicity. They ran copper levels. They found high copper levels compared to values that are known in, certain species. They were higher than sort of the normal levels that we think are normal. And then they treated them for it, and then the birds got better. So there's good anecdotal evidence to support that, okay, those higher levels that we actually found in the blood probably are really indicating that there is copper toxicity going on with birds, and we have a way to treat it too. So it's something that's more of a, hey, we need to have this on our radar as a possible problem, as opposed to something that was like this real discrete, we know all the information about. This is one of those where it allows us to say, take a step back and go, okay, there's a lot more questions that we have based off of this talk, but it's a great stimulus for us to investigate other things that could potentially be going on. Because as a veterinarian, something frustrating happens every once in a while, and that is we don't get a diagnosis of why a bird is acting ill. And it's really frustrating for owners. And I have to tell you, it is horribly frustrating and annoying for veterinarians because we just want to help these animals. And when we don't have an answer for an owner, it's so those things keep us up at night as veterinarians. And we wonder, wow, what could we have done differently? And now we have, well, okay, maybe what about copper toxicity? How, have we thought about that? Could that be something that's going on? So something else to think about.
Dr. Lamb, just real quick.
Yeah.
Sorry, while you were talking about, I just did a really quick Google, and I had an item pop up on Amazon for copper bird toy, bell toy. Is that something that you want to substitute out with stainless steel? But because apparently there's at least one that popped up as a bird toy that's made from it's a copper bell.
You know, that's a really great question. And I have to first say, I don't know the answer to it, because there's, again, still so much that we have to learn about what copper toxicity, like how much copper do they have to get before it actually causes them to be toxic. I would say in the interim, before we have more studies to really say, probably best to avoid it, probably to have better to have stainless steel than to have a copper toy. But yeah, this is something honestly that is I think we're going to learn a lot more about, probably, because not only affecting our pet birds, but there's the question about, could it be toxic for wildlife as well? So, you know, we definitely need to do more studies, but I would say in the interim, before we know, probably best to avoid having, a copper bell in a bird toy. So. Okay, so the next thing is ILE, or intravenous lipid emulsion therapy. ILE is just easier to say, but what is it? Well, it's an IV, so intravenous, so something that we give into the vein, lipid product that is actually used to treat toxins that are more fatty toxins. So there's a lot of different toxins out there, and there is no single antidote for every toxin. That covers every toxin, I should say. There are different antidotes for different toxins. So certain toxins are more like a fat-based toxin, and this particular therapy is good to use for birds that have gotten into something that is toxic and is more of a fatty sort of compound. And so this, or could be bound up by fatty stuff. This presentation was also really interesting. There was a case of a hike that had ingested marijuana, and it had obtained toxic levels of it, enough for it to be clinically having signs and symptoms and problems. And so that particular toxin, when it gets to levels that are toxic, it is one that can be treated with this lipid emulsion IV therapy. What it does is that lipid emulsion therapy binds that toxin and helps them excrete it. So it gets it out of the body so that it's no longer affecting the different parts of the body that allow them to show clinical signs. So this bird was treated with this particular therapy, and the bird improved, which is really awesome. Something that's, I think, important for people to know about, because I think this is a good point to bring it up, is that because there's so many different potential things that are out there that are toxic, and it all depends on also the dose of something that an animal gets as to whether or not it's toxic, because there may be a toxic product, but if you get a tiny bit of it, it may not actually be toxic. Like, for example, like people will know about like chocolate toxicity, right? Like you don't give your animals chocolate because it's toxic to them. But a tiny little bit, depending upon the size of the animal, of course, isn't going to cause too much of a problem. But if you get a larger volume of it, that's when it's going to cause toxicity, and that's when it's going to have the potential to be problematic. And there are a couple companies that have like a poison control hotline, a pet poison hotline. Those companies that actually, that is what they do. So like if a animal ingested some sort of toxin, then a veterinarian or an owner is able to call these veterinarians that work at this toxicology places and say, here is what the animal is, here's what it ingested, here's how much of what it ingested, or sometimes I don't know exactly how much it ingested, but I know it got into it. And the Pet Poison Helpline and the other toxicology groups that are out there can say, okay, this, yes, it has a likelihood to be toxic, and here's what needs to be done. And go to the veterinarian, and the veterinarian's going to need to do X, Y, and Z thing. And this particular case was one of those. And so this was interesting because it was presented from the veterinarian who treated the bird, but then also how they contacted the Pet Poison Helpline to help them make the decisions on the treatments and really what does this individual need. So if anybody has a pet that did ingest something that was toxic, it is very likely your veterinarian is going to say, hey, we need to tell the pet poison people because we want to make sure we are doing everything right by this animal to get them the most rapid help and resolution of their problems. So, but this intravenous lipid emulsion therapy can be used for other fat soluble toxins too. So it was just marijuana in this case, but there's absolutely many other things that this has the potential to be helpful with. So also a newer and exciting thing that's out there. Okay, so now I wanted to go into just sort of the reviews that were done. And just kind of hit on those things, because again, reviewing stuff is always important. As a veterinarian, we have to remember what we've learned and go over it again to really solidify and help us understand, yeah, I know exactly what this particular problem is and how to manage it. So there was a good talk on cloacal prolapses, and they really mentioned that, yeah, it's a common problem. It's something that is seen pretty frequently. And when you work in a veterinary hospital that sees birds, I would say this is one of the more common emergency calls that we will get is, oh my gosh, my bird has this red thing coming out of its bottom, or sometimes the owners know my bird has a cloacal prolapse. I have seen pictures of it, or they've dealt with it before, but it's something that's really quite common. And this talk really emphasized the fact that there are multiple things that need to be considered and multiple angles that we sort of need to come from to really care for birds that have these cloacal prolapses, because there's not a one size fits all to treatment for birds that have cloacal prolapses. And that this talk really went over, okay, here's different reasons why cloacal prolapses can happen, and here's the variety of different things that we could do. Yes, we need to get that cloacal prolapse reduced and back into place rapidly. But where do we go from there after the cloacal prolapse has happened? After it's happened, we have to prevent it from happening again, because a lot of these cases it's going to happen again if we don't try to do something to really figure out why it happened in the first place and resolve that. So this talk was really great reminder for all the different angles that we need to address when dealing with cloacal prolapses, from the actual initial presentation to the pain control or supportive care therapies or hormone therapies or behavior therapies, to even surgeries that are more like attempting to be permanent fixes. But I even say permanent with quotations there, because our goal is for these surgeries to really, that we can do to be permanent fixes, but sometimes best laid out plans don't always work as well as we would like them to. So that was a good talk. Another really good talk was on pain management. And this one I think was really important, because, when humans are ill and humans have something painful going on, we let people know. We can tell each other, hey, I'm in a lot of pain. I don't feel good right now. I need some help. But our parents really can't do that, right? They can't say I'm in pain. Maybe some of them can, but do they really? Most of them have the ability to say that and understand it and convey that to us appropriately. And so this talk was on many areas of pain management. But first off, how do we recognize pain? You know, what do we look for to indicate that a patient is painful? And I put this picture of a green cheek conure up because to me, this is a conure that looks painful. And there's certain things that I'm looking at, because me just looking at it and going, oh, that looks like a painful conure is like, it's very nebulous. Like, what is it that I'm actually looking at to tell me that this individual is in pain? And looking at him, what I can see is, well, he's kind of got this hunched body posture, right? Like, I mean, I know he's standing on this top of this carrier, and it's not at, you know, it's on a normal perch, so he's not going to be at like a typical, you know, straight body, but he's still hunched more than what he should be. So he's kind of hunched up, he's got some feathers ruffled and fluffed, and his tail is like ever so slightly tucked, and then his eyes, I mean, that really tells me a lot, because that facial expression is one that's either saying, I'm really sleepy, I don't feel good, or I potentially am in pain. Closing the eyes like that, especially if we're in an environment that's new and foreign, is something that shouldn't be happening in a bird that's comfortable. If you have a bird that's comfortable, that's healthy, it should be in a new environment, having its eyes nice and wide and open and looking around and being inquisitive, and not being hunched over and kind of tucking the tail a little bit, a little fluffed. These are all indications that this bird could be in pain. And so that was discussed of how do we actually recognize pain? What are the things that we can objectively say, as opposed to subjectively, I can just go, oh, the bird looks like it's in pain. I need to objectify it and say, the eyes, the feathers, the posture, these are the things that I'm looking for me to say, this animal is in pain. And when I can recognize that and I make it more of an objective as opposed to a subjective thing, then that's easier for me to convey to an owner that, yeah, I really do think your bird is in pain, and I think your bird needs some pain medications. Because one thing that we come across a lot is, well, if the animal isn't screaming, it must not be in pain. And well, some animals cry out when they're painful, but not everyone does. And if you think about it in people too, like not every person cries out when they're in pain. Yeah, a lot of them do, a lot of us do cry out when we're in pain, but not everybody does. And so we have to recognize that screaming is not necessarily an indication of pain, and we can show pain in other ways. And when we start to recognize that, then we know that we need to treat it. And the talk was going into, well, what do we treat them with? Because there's lots of pain medications that are available, but what ones actually work for birds? And you know, there's variability in different species. And so again, a lot of times we look to mammals, you know, like what works in the mammal. We grab stuff that we know works in mammals and try to apply it to birds. And sometimes that works great. Sometimes we can say, yeah, this particular pain medication that we use in mammals equally works well in birds. Here's the dose, you know, go ahead and use it. But there's sometimes where we go, hey, here's this pain medication that's in mammals, maybe we should try it in birds, and we find out, actually doesn't really work that well in birds. And different types of pain medications that don't work so well in mammals work better in birds. And then there's different species variability. So what works in a green cheek conure may actually be a different dose than what works in a African gray, or in a falcon, or a goose, you know. And there's so much variety of species that we have to recognize that we need to do different studies on different species to truly know how to treat them most effectively, and what levels of pain control they need. All right, the next thing is zoonotic diseases. So first up, a definition is in order, because zoonotic is a weird word, right? And zoonotic is a disease that can be transmitted from animals to humans. And so there was multiple diseases that were talked about, but I wanted to particularly just focus on talking about chlamydia psittaci. So chlamydia psittaci is also known as just chlamydia, or you may have heard it as chlamydophila, or psittacosis, ornithosis. It goes by many different names. But it is a bacterial infection that is present, or has ability to be present in birds. And there's like so many different species of birds that's actually been identified in. It's just that parrots are one of the more common species that chlamydia psittaci has been identified in, hence the name psittaci. It's like cytosine, right? But this is something that people can pick up from birds. And I don't want to bring it up because to scare anybody, because, when we start talking about diseases and if they're communicable or not from an animal to a human or from animal to animal, a lot of people start to get nervous because they go, oh my gosh, I could pick this up, or my other pet could pick this up. And yes, that's true, you could. But I bring it up more for awareness because we need to be looking out for this particular disease so that we don't have it transmit from one bird to another or from one bird to a person. And when it comes to this particular disease and many other zoonotic diseases, as a generalization, the people who are going to be more likely to pick up something like this are going to be children, elderly, or immunocompromised individuals. So, if in your home you have any of those people in your house, or you yourself have any fall into one of those categories, it's important for you to recognize that sometimes there are diseases that you can pick up from your pets, and you can test your birds for chlamydia. It's a test that's easy to do. There's a couple different tests that can be done, some with better sensitivity and specificity than others, but this is something that is good to check birds for, especially when they're coming into a new home. Taking your bird to the vet, checking them for infectious diseases, particularly this one because people can pick it up, ensuring that they're not carriers, and bringing anything into the home. I put this picture of this little lovebird here only because I'm in Arizona, and so because I'm in Arizona, we do have wild flocks of lovebirds that aren't supposed to be here, but they are. They're very cute. But we do actually have a certain level of chlamydia psittaci that's actually out in our wild lovebird population, and it varies from year to year as far as like how much of a problem it is. And people pick up these baby lovebirds all the time out here in Arizona, because a baby fell out of a nest, and so it's important for people to know this, because if you're in Arizona and you pick up a baby lovebird that's not meant to be here, you may want to take it to a vet, even if it seems like it's healthy. I highly encourage taking it to a vet, having it tested for this, just because you want to be safe. And sometimes a bird can carry a disease and not show signs of the disease. One of the sort of issues with avian medicine is that birds are great at acting like everything's fine and not having sometimes external signs of problems. And then later on, when they are stressed or immunocompromised, or something else is going on, or it's the disease process is built up to a point where they just can't compensate anymore, then they end up showing signs and symptoms and having problems. And so it's good to test for this. It is good to make sure you don't have any birds with chlamydia in your house, for the health of the bird as an individual, for the health of other birds in the home, and for the health of people in the home as well. All right, this was the last thing that I wanted to talk about from a talk at ExoticsCon, and it's about sedation. And the thing is when we're thinking about doing like procedures on birds, whether they're maybe some simple procedures, like maybe we want to get an X-ray, or maybe we want to do something that could be a little stressful for the bird, or maybe we're doing some major surgery, we're often talking about the need for sedation and or anesthesia, because we want to reduce stress on a patient. We want to maybe make them not move so much for whatever it is that we're needing to do. Or again, if we're doing some major thing where it's a major surgery, they need to be completely asleep so that they aren't moving, that we aren't having problems, there's no stress, pain, anything like that. And so this talk was really mainly just about the sedation side of things. And one of the big things to point out is that sedation is safer than anesthesia. Now, sedation is just where we are giving medications that are going to kind of make the animal sleepy, but it's not going to be completely out. They're just going to be a little bit more calm, relaxed. Maybe they're taking little naps, but they're you can rouse them, you can get them awake, versus anesthesia is they're completely asleep, and not really sensing the pain from any sort of procedures or anything like that that's going on. And I've had lots of people who are afraid of sedation or anesthesia, and it's okay to be a little concerned, because you can never say that anesthesia is completely without risk, and that's something that I have conversations about with owners, like every time we do anesthesia, because anesthesia is something where there is risk associated with it, but sedation actually is safer than anesthesia. And so if we can get away with doing some sort of procedure without anesthesia, and we can do sedation, that's kind of what we want to do, because it's a safer route to go. So I hope to impart that by saying that, to hopefully make it so that people are a little less afraid of sedation, because sedation is actually pretty safe based on the sedatives that are used, and there are many good sedatives that are out there that are very safe sedatives, and so I hope that in me saying this, that owners can feel maybe a little bit more comfortable that, hey, it's not so bad if we need to use sedation. Anesthesia is a little bit more involved. Sedation is going to be more for just kind of like a twilight, as sometimes some people will call it, the animal's not completely under. And the talk really went over different types of sedation, because there's lots of different sedatives that are out there. And so this went over what's appropriate for birds, what can we use for birds, what are the doses for birds, what's safe for birds. So it's just a lot of repetition of here's what is okay for birds, here is the doses that we can use safely in birds, and how can we sometimes combine some of those sedatives, because the different sedatives work in different ways, and some may be having some like pain control as well, and some don't have pain control. And so if we're doing something that could potentially be painful, we have to think that okay, well, maybe I'm using this sedative for the real, like, okay, I'm going to get this bird sleepy, but I'm going to use this sedative as well, like I may be using two together to cover pain as well as get them a little sleepy. So that's what that talk was really about, and it was again a real good reminder of how to use these drugs safely and effectively to help our patients, so that they are not stressed, we're able to do what we need to do to help them, and also being pain-free. So I believe, yes, that was my last one. So I'm going to stop sharing here. Okay. And so I've left, it looks like 8 minutes for any questions that you guys have that I can answer for you.
Okay. That was awesome. It must be so. Do a lot just when you're at these conferences. Just curious, how much of the talks on like just in the hallways or over coffee are you getting a lot of like stuff you never thought of before, or new ideas? Like, is that where a lot of like those informal settings too, with a bunch of vets in the same?
Absolutely. When you get a bunch of vets, techs, the allied associates, people together who are all really interested in birds, there are some really interesting conversations that happen outside of the lecture hall, and a lot of good questions that are brought up to stimulate, oh, maybe we should do this, or maybe someone comes out of a lecture and they go, wow, that was a really interesting lecture, what do you think about what they said on this, what about this side of things? And absolutely there are new studies that are planned over coffee,
On a cocktail napkin.
outside of the exam room.
Yeah. On a little napkin in the
Yeah.
Okay, we do have some questions for you. Let's see. So how many certified avian vets and how many avian veterinarians are in the US? Just a ballpark figure if you're.
Okay. So I have looked this up before, and it does change year by year, because so I'm boarded through the American Board of Veterinary Practitioners in Avian Practice, and you have to like recertify every 10 years. And so, annually. Somebody new comes on, and somebody maybe is no longer they're retiring, and so they're not maintaining their certification. So, but last I looked, I think it's around 130 board certified avian vets that are avian specific in the U.S. I think a couple are out of the U.S. that are boarded through the American Board of Veterinary Practitioners that encompass that approximately 130. As far as other board certifications, there's also people who do boarding in like zoo medicine that do a lot of birds as well, but aren't just bird specific, like my board certification. I don't know how many of them there are. And then as far as like other veterinarians that maybe aren't boarded but do a lot of birds, that's really hard for me to say for certain. That I would actually have to go probably look at some data that's on the Association of Avian Vets website, because they do have like a find a vet feature that probably tallies that to some degree. So I can say about 130-ish approximately board certified.
Okay. Okay. And then a question about did they discuss any possibility of copper toxicity from copper piped houses? Are there any, and what would be symptoms of copper toxicity?
Yeah, so as far as the houses, I don't think that there was any discussion on it being from copper pipes, because I think it was really all mostly about like a lot of birds like had a metal object that was found in the gastrointestinal tract on radiographs, and then were like GI sort of signs that were seen, and they tested for lead, they tested for zinc, and they're negative for lead and zinc, and they go, well, hey, maybe let's test for copper, and that's when the copper was high. But other signs that could potentially be seen associated with copper toxicity, anorexia, so they're just not eating. It can cause GI upset, as I mentioned. It can cause like ulcerations in the ventriculus and proventriculus. In other animals, it's caused anemia, and I have a case that I had that I do think was copper toxicity, and it was having anemia, so low red blood cells. And so when you have low red blood cells and you're anemic, you just feel tired. So you're just like not really wanting to do anything. You're sitting around. For a bird, that would be like sitting on a perch, just lethargic, fluffed up, maybe kind of like being sleepy. So mostly GI and anemia is kind of the big things. But there's also it can cause kidney problems. So they may have like a lot of water in the droppings as another possibility too.
Okay. And so question about are any of the lectures from the ExoticsCon available online? Is there any, do they allow any viewing?
No, there have been years where it has been recorded, but this last year it was not recorded. So no lectures available online this year.
Okay. And can anyone, I mean, cannot anyone, if you're a non-vet, can you attend ExoticsCon? Or I know like vet students can and vet techs, right? Just wondering.
Yeah. So veterinarians, technicians, vet students. There have been like undergrad students as well, like people who want to get into vet school. There's also like an allied members thing too that they can attend as well. So to some degree, yes, other people who are not veterinarians can as well, but not necessarily everybody.
Okay. And so question from someone I wanted to know, are we any closer to finding a cure for AGY? So you want to define what AGY is, and are we closer to a cure to it?
So AGY is avian gastric yeast, and it is also known as Macrorhabdis ornithogaster. It is a yeast organism that lives in the GI tract, most common in smaller species, so like budgies are kind of the poster children for it. As far as a treatment, there are treatments that are available, and the biggest one is going to be amphotericin B. That's the one that's been found to be the most successful in studies that have been done. There have been other things that have been tried as well with variable success. And even amphotericin B isn't 100% successful, but it is sort of the best that we currently have available to us. But there are some little idiosyncrasies of that particular infection that make it difficult sometimes when we're managing them.
Okay. Okay. I think, let's see, probably our last question, which is my 20, it's someone, a 25-year-old cockatiel on meloxicam for, uh, crepitus, arthritis, and arthritis. Is that a relatively safe med to give? Also switched him to Lafeber pellet diet. He is doing well. So,
Sorry, well, I missed the drug. What was the drug?
uh,
You said you had
meloxicam for, yeah,
meloxicam. Okay. All
sorry.
right. Sorry. I thought that's what you said, but I just wanted to
I
make
could
sure
have
I heard
mispronounced
correctly.
it.
So meloxicam or Metacam is a like trade name, or minoxidil, that's another trade name too. Very, very common medication that is used in birds and a lot of other species too. It is used for pain. So it's talking about the crepitus, which is basically like kind of creaky joints from arthritis. Yes, that is safe to use. There are definitely lots of studies on its use in birds. So we know like some species require different levels over others. But it is one that we do usually recommend if a bird's going to be on it chronically, that they have blood work checked like every 6 months to 12 months, depending upon like how frequently they're using it and potential risk factors for other problems. It is pretty safe. I have many patients who have been on it for years for different reasons. And yes, we like to keep up on blood. We like to look at liver values, kidney values, because sometimes it can have side effects on the liver or the kidneys. But the good news is those side effects are not very common. But if we do see those side effects, then we take them off the medication because we don't want to have problems from it. Or if they have liver or kidney problems beforehand, then we have to really consider whether or not that's the appropriate medication to give them. And that's going to be dependent upon the individual bird. So, but yes, pretty appropriate and safe to use.
Okay. Just, do you have time for one more just popped in? Okay. So this is a 28-year-old umbrella cockatoo that has a history of 3 failed surgeries for a collateral prolapse prior to coming in to us. We will not allow another procedure. Unfortunately, she tends to be rather smelly. Is there anything other than warm water with a pinch to mild soap that can help control this? They don't have any vets in their area, so yeah.
Gotcha. And one thing I will say that has changed, because I just want to make one comment, and I don't know of this particular case, but there's different types of cloacoplasties that have been done, or ventplasties that have been done, and there's asymmetrical and symmetrical ones, and the current thought is that the asymmetrical one is the better one to do. I'll be totally honest, when I have somebody who comes in and says that they, they have a bird with this problem and I'm suggesting we do surgery, I always tell them my goal is for this to be a one-time surgery, but there are a certain percentage of individuals that this is not going to be a one-time surgery. But I have had cockatoos that have had like 3 or 4 surgeries to repair that cloacal prolapse. And then when done with the asymmetrical cloacal prolapse or asymmetrical cloacoplasty surgery, have success. But I do know of a couple that have failed as well. So again, not 100% perfect, but if they haven't done the asymmetrical cloacoplasty, even though they said they won't go do any more surgery, I just want to throw that out there, that if that was not the procedure that was done, that is currently the preferred procedure to do. But to answer your real question, which is, can you do anything to make the smell go away? It is very difficult, honestly, because they just get so messy down there. So one thing is just like daily little like rinsing back there. You can put a little apple cider vinegar in a water bottle, like 1 tablespoon to 8 ounces of water, 1 tablespoon apple cider vinegar to 8 ounces of water in a spray bottle, and use that to kind of mist near those feathers by that butt to kind of help get some of the gunk that is there to come off, and maybe keep that little environment around the cloaca along the skin there a little like cleaner. And the apple cider vinegar does alter the pH, so it kind of tries to promote a environment that's less favorable for some nasty bacteria to be there, but it's not perfect, because with that stuff just constantly being there, it's poop, right? It's the smell.
All right. And I'm sorry. One final one. If you sorry, this one is like a last one, please, from Brenda. So I know it's something that we want to ask. So the question is, this is somewhat strange, but I am recovering from an extensive surgery where they used nerve blocking instead of anesthesia. Has this been studied at risk exotic patients, or is it or is it just impractical? The nerve blocking was completely reversible. So it can use a nerve blocking.
I guess, okay, so when I hear the word reversible, it makes me go, is it reversible that they gave something to reverse it, or is it
But it
reversible
wasn't
to
from
wear
Brenda.
it off?
Sorry, go ahead.
Okay, so because
That's from our friend.
we definitely use nerve blocking agents, and absolutely there have been times where I have not wanted to put a bird under anesthesia, and I go, okay, I'm going to give you sedation with pain medication, and I'm going to do a local block to just be a local anesthetic around this area so I can do a procedure. And I honestly use that kind of more and more for any sort of toe surgeries. If I have a bird who has some sort of toe injury or needs a toe amputation, there are many birds that I don't put under anesthesia anymore, and I just do local blocks and good sedation and pain control, and so that I don't have to have them have that risk of going under anesthesia. But it's not for, like, if I have to do a costomic surgery where I'm opening up the abdomen, that we're not sophisticated enough yet for that, for me to use any sort of local block for that yet. But I may use that as part of my, like I may use a local block on the incision so at least the patient is comfortable, more comfortable in that spot. So
Gotcha. And when you're dealing with, like, a powerful beak, how do you restrain, like, just imagining like a big beak with a local block, is there?
well, so if I say I'm doing like a toe surgery, right, where I'm like, okay, I'm going to do my sedative, my pain medication, and my local block, somebody is holding the bird. Somebody is, I have a nurse who's holding the bird, restraining it appropriately so I don't have a beak going, hey, what are you doing? And grabbing me.
A brave assistant. Wow. Okay. Sorry. Thank you for the bonus Q&A at the end there. Appreciate that. Some really important information that was covered today. And I think this is awesome. We're finding out before even some vets do what's the new protocols up and coming. So this is awesome. Thank you for the information and the really good rundown of what your takeaways from an important conference. So so I'm going to announce today's winner of, we're going to give away some banana NutriBerries in the collectives tin, which is a limited time only. So if you haven't ordered your banana NutriBerries, you should go online soon because it's a limited edition. But those special gold tins are super awesome. I know Arroyo likes them because I've seen the videos and my bird does too. The winner today is Tony Rossi. Congratulations, Tony. You'll be getting some banana NutriBerries as well as another Lafeber product of your bird's choice. And let's see, before I forget real quick, so we're swapping out our webinars for next Friday. We're going to have, instead, Lisa Bono is going to be rescheduled, but she will be back on with us. In the meantime, we're going to have next Friday, we're going to have another episode of Translating Parrot with Pamela Clark. And the topic's going to be the best life, tips and essential practices for parrots of all sizes. So that's something we all want to learn from too. So tune in next Friday. Dr. Lamb, thank you once again for an awesome presentation, and congratulations for now being the active president of the AAV, which is the Association of Avian Veterinarians, which I believe is a role that you were bestowed from your fellow avian veterinarians. So there you go.
Well, thank you very much.
Very well earned. All right, guys, on that note, I'm going to wish everyone a very happy weekend. All the best to you and your flock. Stay safe until next time. And thanks again, Dr. Lamb.
Bye.